So we're gonna do tangential view of the patella. If you had to order, if they ordered a patella, the routine views would be a PA because it would put the patella closer to the IR, a lateral, and then a tangential view. And a lot of times with a knee, protocol is to get a tangential of the patella as well. Tangential just means skimming apart. So go ahead and swing your feet this way. All right. And with this one, there are 5 different ways you can do this particular tangential view. They call them all sunrises because what it does is brings the patella up off the femur so that you end up with a joint space in between. There's 5 different, there's a Setagast method, there's a Hobbs method, there's an infra-superior method, a supro-inferior method, and I'm blanking on the 5th one, but trust me, there's 5. We only do 1 of them. So I'm gonna show you guys how to do the infra-superior, which basically means the tube is gonna be angled. It's gonna come in from the inferior aspect, exit the superior aspect, so that we just kind of skim that patella right off. So in order to do that, I'm gonna have, actually come down this way just a little bit. I'm gonna have the patient, oh gosh, I'm so sorry.
No, you're good.
We're gonna bend his knee a little. Good. We're gonna bring the IR back behind just like that. I'm gonna move the table today. I would have a shield on him already. So let's move. Here, pick that up for a second. Put it down, actually protect what we're protecting.
Is it right where you had it?
It doesn't.
Okay.
We'll get it there.
Okay.
I'm just gonna start kind of like that. Okay, so the tube on this one, you kind of want to start with the tube at a 90-degree angle. And then we're gonna bring the tube down. The biggest thing you want to warn your patient before you hit the light, because a lot of times it'll blind them. You're gonna bring it down, and then it's a 10 to 15-degree angle. I would call it superior angle because you're starting from vertical and then coming up. And then all you're gonna do is bring it down so that the crosshairs are coming underneath that patella and projecting it up. That's about how much of the knee you would have on there. And then you can kind of see the crosshairs. We just wanna center it like that. And then we're gonna collimate down to it, just like that. This would be right. Can we stick a marker in there? Just like that. And what this is gonna do with the crosshairs right here, it's gonna come underneath that patella and just project. That patella is gonna end up being here, and you're gonna see a portion of the femur here, and there's gonna be a joint space right in the middle, and that's why they call it a sunrise view. So infra-superior, if they did it the other way, which sometimes in the field they'll put the IR down here, the tube would come this way, and they would do the opposite, where it would come from the superior aspect of the patella and exit the inferior aspect. Okay, and that's pretty much what it looks like without actually making the exposure. I feel like that would be just right because it's just below the patella, and then it's going to project it right off. Make sure your patient is shielded. The hardest part with this, he's a really good patient.
That's right.
Most patients aren't going to be able to hold this like this. That's why they usually opt to go the opposite way and have an IR holder.